Welcome to Home Care Business Insights, your go-to resource for exploring the many aspects of running a successful home care business. Whether you're an industry pro, new entrepreneur, or just curious about the industry, this podcast offers strategies, tips, and solutions to help you succeed. While AI-generated voices host the episodes, the insights are real and designed with your growth in mind. Let's dive into what matters most in building a thriving home care business. Now let's hear from our AI hosts.
Welcome back to another deep dive on home care business insights presented by Caring Senior Service. I am so glad you're joining us today.
Yeah, thanks for having me. We've got a really great discussion lined up.
We absolutely do. So I want to start with a quick analogy for you. Think about opening a restaurant. You know, you don't actually need to be a classically trained chef to run a wildly profitable restaurant.
Right, definitely not.
I mean, a savvy investor who can barely make a grilled cheese can hire the right people, master the logistics, understand hospitality, and just build an absolute empire.
For sure. We see that all the time in the business world.
Yeah, exactly. But if you actually are a chef, well, you walk into that kitchen on day one with this highly specialized, really granular instinct for the ingredients that, an outside investor is just never going to possess.
Yeah, you feel the rhythm of the dinner rush before you even turn the lights on.
Precisely. And today, we're looking at that exact same dynamic, but we're applying it to the ingredients of the home care industry.
Which is such an important topic because, in our last deep dive, we spent a lot of time completely dismantling a big myth.
The myth that you have to have a medical background to succeed.
Right, exactly. We looked at how former military officers, corporate sales execs, and, lifelong entrepreneurs step into this franchise space and just absolutely crush it.
Because leadership is universal.
Yes, leadership and operational discipline are universal. You don't need to be a nurse to be a great franchise owner.
But, and this is our mission today, we have to look at the other side of that coin. What if you do have that background?
Right. What if you are that chef?
Exactly. If you're a nurse, a physical therapist, a healthcare administrator, maybe a social worker, case manager, what actually happens when you step into the franchise owner seat?
Well, you were walking in with a massive head start. I mean, it's undeniable. And that advantage, it doesn't begin with like a spreadsheet or some clever marketing strategy. It begins with the profound reality of what you've already witnessed on the clinical front lines. You have this intimate, really unteachable understanding of the patient's actual lived experience.
Okay, so I get that. I get that a clinical professional brings a huge amount of empathy to the table. I mean, if you're a nurse listening to this right now in your commute, you know exactly what caregiver burnout looks like.
Oh, absolutely. You've seen it firsthand.
Yeah, you've held the hands of the adult daughter who hasn't slept in 3 days. But, I mean, let's be real. Empathy doesn't make payroll.
No, it doesn't.
A floor nurse isn't typically analyzing profit and loss statements or, calculating customer acquisition costs. So how does bedside compassion actually translate into surviving as a cutthroat business owner?
That's the million-dollar question, isn't it?
Yeah.
But here's the thing. In this specific industry, empathy actually is the ultimate operational intelligence.
Wait, really? How so?
Yeah, because we're talking about the mechanics of the healthcare system itself. When a clinical professional transitions into home care ownership, their empathy is directly tied to identifying systemic failure points.
Oh, I see where you're going with this.
Right. I mean, think about the most frustrating part of modern medicine for a clinical provider. You have a patient in the hospital, you give them world-class medical treatment, the surgery is a total success.
The vitals are stable.
Exactly. Vitals are great. You discharge them with this flawless clinical care plan, and then, 3 weeks later, they're readmitted in critical condition.
Ugh, that has to be incredibly frustrating. It feels like it's the equivalent of building a beautiful multi-million-dollar house, hiring the best architects in the world, and then just completely forgetting to put a roof on it.
That is the perfect way to describe it.
Right. You send this vulnerable patient home, but if they are too weak to stand at the stove and cook a nutritious meal, or they simply don't have a ride to the pharmacy to pick up their antibiotics, well, the house floods.
Yeah, it just floods. And all of that incredibly expensive clinical work is completely undone.
Undone by just a lack of basic support.
Exactly. Basic non-medical support. And healthcare professionals, they see this specific breakdown every single day. They know that medical outcomes just plummet when the social determinants of health are ignored.
So when they open a home care franchise,
they aren't just trying to figure out a business model from scratch. They are actively building that missing roof. They understand that home care is the critical bridge in the continuum of care.
It's the infrastructure connecting the clinical treatment to actually living safely at home.
Right. So to answer your question about business advantage, they inherently understand the product they're selling better than anyone else.
Because they've spent their whole career staring at the exact gap this product is designed to fill.
Exactly. They know the gap, they know the stakes, and importantly, they know the exact vocabulary of the people desperately trying to manage that gap.
Okay, let's talk about that vocabulary, because I think we have a tendency to drastically mischaracterize what a healthcare worker actually does all day.
Oh, completely.
Like when people hear the term, they instantly picture someone taking blood pressure or, adjusting an IV or pushing a medication cart down a hallway.
Which completely ignores the massive logistical engine running behind the scenes.
Right, exactly.
I mean, think about a clinical director, a practice manager, or a nursing supervisor. They are already running a high-stakes, highly regulated small business.
Yeah, they really are.
A nursing director in a mid-sized facility, for example, they're managing complex, multi-million-dollar budgets. They're navigating chronic supply chain issues.
And dealing with staffing, which is huge.
Huge. They are supervising large, diverse staffs with notoriously high turnover rates, all while maintaining strict compliance with labyrinthine government regulations.
So they're essentially doing CEO training every Tuesday.
Basically, yeah.
Mediating conflicts, balancing competing operational priorities, ensuring that a multidisciplinary team is functioning under extreme stress.
And that is just internal operations. Let's look at external business growth.
Okay, let's go there.
In the home care franchise world, a massive driver of your revenue is your local referral network. You really need the local hospitals, the rehabilitation centers, and the hospice agencies to recommend your caring senior service agency to their discharging patients.
Which means someone has to walk into those massive institutions and actually sell the agency's services to the discharge planners.
Right. And if I'm coming from, say, a corporate software sales background, I have to learn an entirely new language to make that pitch.
Yeah, you have to figure out what a discharge planner even cares about.
Exactly. But a former healthcare professional, they skip that entire learning curve. They already speak the language fluently.
Because they used to be on the other side of that desk.
Exactly. They know the exact metrics a rehab facility is trying to hit. They understand the immense regulatory pressure a hospice social worker is under.
So how does that actual conversation play out? Walk me through the mechanics of it.
Sure. So a former case manager walks into a hospital to build a referral relationship. They don't just hand over a glossy brochure and say, hey, we offer great home care.
Right, which is what a lot of salespeople might do.
Yeah, instead, they look the discharge planner in the eye and say, I see your 30-day readmission rates for congestive heart failure. Patients are threatening your Medicare performance scores.
Oh, wow. They just cut right to the chase.
Right to the pain point. And then they say, my agency can take your high-risk discharges, ensure they are eating low-sodium meals, guarantee they make it to their follow-up appointments, and protect your margins.
Man, that isn't even a sales pitch. That is a peer-to-peer clinical strategy session.
It really is. It completely bypasses that traditional vendor-client friction. It establishes immediate, undeniable credibility.
Because the message is, I've been in your shoes, I know your pain points, let me deploy my team to solve them.
Exactly. And the same mechanism applies when they sit down in the living room with the families.
Oh, that's a whole different dynamic.
It is. Families seeking home care are almost always in a state of crisis. They are terrified, they're confused, and they're making highly emotional, very expensive decisions about someone they love.
Yeah, they're suddenly drowning in medical jargon they don't understand, trying to decipher discharge papers and medication schedules.
And a former clinical professional knows exactly how to de-escalate that panic. They translate the clinical reality into plain English.
Which is such a gift to those families.
It is. Their ability to educate the family, to set realistic expectations about the trajectory of a disease like Parkinson's or Alzheimer's, it just builds a level of trust that simply cannot be manufactured.
And in a relationship-based business like home care, trust is basically your most valuable currency.
Without a doubt.
All right, we're going to take a really quick break for a commercial, but stick around because when we come back, I want to challenge this from a totally different angle.
Sounds good.
If you're a healthcare professional who's been wondering what's next, here's something we've seen time and time again. Healthcare professionals make exceptional franchise owners, and it's not by accident. You spent your career solving problems under pressure, leading with compassion, and putting people first. Those aren't just healthcare skills. their business skills, especially in home care. What you may not have yet is a proven system to turn those strengths into something you own. That's where franchising comes in. Instead of starting from scratch, you're stepping into a business with established systems, ongoing support, and a team that's invested in your success. For many healthcare professionals, it's a natural next chapter. You stay connected to an industry you're passionate about while gaining more control over your time, your future, and your impact. If you've ever wondered whether business ownership could be right for you, let's have a conversation. Book a quick call with us at caringfranchise.com so we can answer your questions, walk you through the franchise model, and help you decide if it's the right fit.
Welcome back. So before the break, we were talking about the massive advantages clinical folks have when opening a franchise. But I want to push back a little here.
Okay, let's hear it.
Let's talk about the danger of being almost too close to the work. I mean, if you've spent 20 years as a clinician, your entire professional identity is wrapped up in fixing the patient yourself.
Right.
But if you buy a home care franchise, aren't you stepping into a non-medical business model? Doesn't a former nurse struggle immensely with the urge to micromanage the clinical side, or worse, like try to provide the hands-on care themselves?
Oh, that is the pivotal transition. Every single healthcare professional has to make that shift when they become an owner. And honestly, it's a massive operational hurdle.
I can imagine.
Because the reality of most home care businesses, including carrying senior service locations, is that they are heavily focused on non-medical, essential daily living activities.
Like meal prep, transportation, fall prevention.
Exactly. Companionship, bathing. The franchise owner is strictly required to work on the business, not in the business.
Which means putting down the stethoscope.
Completely. It's like imagine a master mechanic deciding to open an automotive manufacturing plant.
Okay.
You are no longer under the hood turning a wrench. You are designing the assembly line. You're building the systems, hiring the managers, optimizing the flow so the engines never break down in the first place.
You really have to let your team do the building.
Yes.
Which honestly sounds incredibly difficult if your default instinct is to jump in and fix the emergency yourself.
It requires immense discipline.
Yeah.
And, the regulatory landscape actually has a fascinating layer to this.
How so?
Well, state laws regarding home care vary wildly across the country. Some states treat non-medical home care with a very light regulatory touch.
Right.
But other states have really rigorous mandates requiring clinical oversight, where a registered nurse actually must be involved in creating the initial care plan or supervising the caregivers, even if the actual services provided are strictly non-medical.
But even in those heavily regulated states, the owner doesn't have to be the one doing that clinical oversight, right? I mean, a franchise owner with a corporate background just hires a director of nursing to handle that compliance.
Exactly. And if the owner is a nurse, they still have to resist the urge to play that role themselves as the business scales.
Right, because they can't be everywhere at once.
Their highest and best use is steering the ship, supporting their administrative staff, and cultivating those massive referral networks we talked about earlier.
Which really brings us right back to the core thesis of our previous deep dive. This operational reality, the fact that you're the architect of the assembly line, not the mechanic, is exactly why non-healthcare professionals succeed at the exact same rate.
Yes, because if your primary job is building a culture, analyzing market trends, and leading a team of 50 caregivers, well, the leadership traits required for that are industry agnostic.
Right. The traits that predict success are universal. It's resilience, clear communication, strategic problem solving.
Exactly. Community-minded entrepreneurship. A healthcare background is a phenomenal launchpad because it gives you a shorthand for the industry's language and this intuitive grasp of the customer's pain.
But the absolute prerequisite is just the ability to lead an organization. You are stepping out of the clinical role and into the executive suite.
Perfectly said.
Which leads me to, I think, the biggest question of all today. If these professionals, these brilliant nurses, therapists, and clinical directors are already so highly skilled and they're already doing vital, life-saving work, why leave?
Yeah, but why?
What is the catalyst that makes someone abandon a stable career in the medical establishment to take on the risk of opening a home care franchise?
To understand that exodus, you really have to look at the psychological reality of modern medicine. Ask yourself, Why do people enter healthcare in the first place?
Usually because they want to help people.
Right. Almost universally, it's driven by a deep-seated, genuine calling to alleviate suffering. They want to make a tangible difference in people's lives.
But then they actually get into the system.
And the system just grinds that calling into dust. Over time, these incredibly passionate professionals run headfirst into a wall of suffocating organizational bureaucracy.
The red tape.
Endless administrative bloat, chronic and demoralizing staffing shortages, and, frankly, insurance companies dictating patient care from a boardroom 1,000 miles away.
Yeah. If you are charting at 2 a.m. because the hospital requires triple documentation for every single patient interaction, you suddenly realize you're spending 10% of your time looking at patients and 90% of your time looking at a screen.
It is the defining crisis of the medical field today. The system systematically removes the provider from the patient.
Wow, that's incredibly sad when you put it like that.
It is. And for listeners out there right now who are working in healthcare, who might be feeling that exact heavy burnout, home care ownership offers a profoundly powerful alternative. It's an escape hatch.
I almost look at it as a rescue mission, not just for the seniors who need the care, but for the professionals themselves.
I love that. A rescue mission.
Yeah, it allows them to bypass the bureaucracy that was holding them back so they can finally deliver the kind of care they always wanted to provide in the first place.
It marries their original core purpose with the autonomy of entrepreneurship. As a franchise owner, you are no longer a cog in a massive, slow-moving institutional machine that views your compassion as just some metric to be optimized.
You're the ultimate decision maker.
Exactly. You get to build a localized culture that actually values and protects its caregivers. You get to ensure that the seniors in your specific zip code are treated with absolute dignity.
You're essentially stepping completely outside the broken parts of the system, setting up shop right next door and saying, we're going to do this the right way.
Right. And from a purely practical standpoint, you get to build a tangible financial asset for your own family at the same time.
Yes, you're building equity in a business that you actually own rather than just clocking in to generate revenue for a massive hospital conglomerate.
It is a fundamentally mission-driven path.
Yeah.
It allows you to take all of that hard-won clinical knowledge, all of that administrative battle testing, and channel it into a vehicle that you completely control.
So let's sort of pull all of these threads together because we have unpacked some serious mechanics today.
I really have.
If you are tuning in and considering this leap, here is the blueprint of your advantage. We started by looking at the raw empathy that healthcare professionals bring to the table.
Right. The chef's instinct.
Exactly. But we quickly established that this isn't just about having a big heart. It's about possessing a highly lucrative operational intelligence. You know exactly where the hospital system fails patients post-discharge.
And you know exactly how home care builds the bridge to catch them.
We also looked at how the daily grind of clinical administration, managing chaotic schedules, fighting for budget approvals, ensuring strict regulatory compliance, is quite literally the exact training program for running a small business.
You already have the operational chops.
And we broke down the mechanics of the referral network. You don't have to learn how to sell to a hospital. You just have to walk in and speak the clinical language you already know.
Offering solutions to the metrics that keep discharge planners awake at night.
But crucially, you also have to be willing to evolve. You have to transition from the master mechanic fixing the engine to the CEO designing the assembly line.
Which is the great equalizer. It's why business leaders from outside of healthcare thrive here, and it's the necessary evolution for anyone coming from inside the clinic.
It just reframes the entire concept of career burnout. It turns it from an ending into a beginning.
I completely agree.
Which brings me to a final thought I want to leave you with today. We've talked a lot about healthcare professionals leaving the institutional system to start their own businesses, but think about the macro effect of that.
Oh, this is an interesting point.
As more and more burned out, highly skilled medical veterans leave these massive hospital systems to open private, community-based home care franchises. They are actively draining the medical establishment of its best, most empathetic talent.
It's a massive shifting of human capital.
Exactly. So how will that eventual talent vacuum force those massive bureaucratic hospital systems to fundamentally change the way they treat their own staff?
Wow.
Right. By stepping out to build your own business and fix the gap in home care, you might just be the very catalyst that forces the institutional healthcare system to finally fix itself. Your exit is the ultimate leverage.
That is a fascinating dynamic to watch unfold over the next decade.
It really is. It's something to mull over as you navigate your own career path. Thank you so much for joining us in Caring Senior Service for this deep dive. Keep questioning the systems around you, keep exploring your potential, and we will catch you on the next one.